Hello friends, I am Dr. Prashant Sharma and you are watching MEDICO'S Hub. This is my fourth lecture on membrane potentials in nerve fiber, and we are going to discuss the attainment of RMP, that is resting membrane potential, by the nerve fiber after reaching the action potential peak of plus 35 millivolts. In the previous lecture, we have observed that at the end of phase of depolarization, the peak value of plus 35 millivolts is reached, that is action potential peak. At this point, the sodium channels, voltage gated sodium channels will close and the voltage gated potassium channels will open. This will result in a rapid fall in the membrane potential, which will reach around firing potential, and this phase is known as E. So what is E? In phase E, which is repolarization, phase of repolarization, voltage gated sodium channels close and the voltage gated potassium channels open. Because of this, the membrane potential decreases and this rapid fall will be observed. D plus E, that is rapid rise in the membrane potential, then rapid fall in the membrane potential, is known as spike potential. This is spike potential. At the end of spike potential, the slow repolarization will occur. This phase of slow repolarization is known as after-depolarization, that is F. So in F, slow repolarization will occur. This is the phase of slow repolarization and the voltage gated potassium channel continue to remain open. Then we know that this is RMP. This is baseline of RMP. And after this, after depolarization, we'll observe that this membrane potential continues to go down. This is because of prolonged opening of voltage gated potassium channel. It's very important to know that the voltage gated potassium channels are basically slower in opening in comparison to voltage gated sodium channels, and these also show prolonged opening. Because of slower opening, their opening is started when action potential peak of plus 35 is reached. This results in repolarization. After this is slow repolarization, and when RMP is reached, then also they continue to remain open, which may decrease up to minus 72 millivolts. So this is G and this one is H. G plus H is equal to after hyperpolarization. This G is because of prolonged opening of voltage gated potassium channels, and finally at the end of G they will close. And this H will finally help in retaining the or regaining the RMP because of activity of sodium potassium pump plus some leaky potassium channels are also open. So finally, we'll revise it. This is the graded potential, which will give rise to action potential. That is the phase of quick depolarization, rapid increase in membrane potential. Action potential peak is reached. Then voltage gated sodium channel will close and voltage gated potassium channel will open. That will result in rapid fall in the membrane potential. Then slow repolarization of the membrane potential. Then prolonged opening of voltage gated potassium channel will result in this G, and H is normalization or regaining of RMP, and G and H are known as phase of after hyperpolarization. F is phase of after depolarization, E is rapid repolarization phase, D is depolarization phase or rapid depolarization phase. This is the graded potential phase, and D plus E is known as spike potential. So this is the action potential, and it also consists of, repolarization consists of G and H. G is because of prolonged opening of voltage gated potassium channels, and this H is attaining of RMP by the action of sodium potassium pump and some leaky channels. Now after this, membrane will again become electropositive outside, and it is more permeable for potassium, because at resting phase we have already discussed that the excitable tissues at resting phase is permeable to potassium mainly. Membrane potential is attained, that is minus 70 millivolts. So this is the action potential. Hit the like button, share and subscribe our channel to get the latest updates and notifications.